Hey everybody, Dr. Albert Snow here, Holistic Gastroenterologist. We're here today for our Friday question and answer. I hope you have a lot of good questions. If we don't get that many, or if we take a pause, I'll got a couple of things I want to share with you about my radio show. It'll be on tonight at 7 o'clock. It's a live Q&A. We can talk about whatever we want. If we want to tell stories, we can do that. If we want to ask questions, but it'll be live. It'll be telephone. You can call in and we can talk back and forth on the telephone. So it's not just the texting like we're doing now. So we're going to try that out. And we're also open to suggestions for any time changes if you're on the left coast or right coast, up or down, time zone. If you have an idea that better for you guys where you are, we might change our times. But we realize that a lot of people listen to the recordings afterward. They're not, they're working or something, and so we're recording it too. So I'll talk more about the radio. It's radio.co is the name of the website, and there's an if you go to my Holistic Gastroenterology.com website, there's an icon up on the left side, like they have for Twitter and such. Yeah, you can click right on that, and that'll bring you right to there. I'll be on there at 7 o'clock Eastern Time tonight, taking calls and whatever else we want to do, tell stories, talk about health. So we have some people who are viewing. Let's see if we have any questions yet. I'm not seeing the questions haven't arrived yet. So I'll talk about some other things until we get those. The radio show is going to be it's going to be a little bit of a gypsy for now. We might do something 5 nights a week. We could do it anything we want. We need to get feedback from you. What's best for you guys to tell us when you're going to be available, unless you like listening at night after work. So I wanted to talk about something. I want to tell you something that came up today. I got an email, and see if I can pull it up now. Let's see, where is she? I got a nice email from a person in UK. And see if I can pull it up. Read it. And where is it? Okay. Oh, they got an email. I got an email from a girl in UK. And she's under my care. And she had been taking a biologic medication. And when I first spoke to her, she was very disconcerted, but she was concerned about her well-being. And I had told her, I assured her that we were going to, here she is, we were going to be able to help her. And she was nervous. And we got some good test results. She sent me this email. I hope she doesn't mind me reading this anonymously. She shouldn't, because no one knows who she is. And we're just sharing a good information. But she goes, I'm late with my update, but was waiting for my blood and stool test results. I'm happy to say that they only saw slight inflammation, and she had a pretty bad problem. And she said there was quite an improvement. That's what the doctor said. Also, and this is something I want to comment on, also that I was anemic and should increase the dose, 1 tablet or for a couple of weeks. This is the iron. Now, comment about iron. When you're diagnosed with maybe slightly low hemoglobin, iron, don't get freaked out over that. The doctors are going to, make a big deal out of it. We put that in the same category as vitamin D. It's bullshit. If you're tired, that's when you take an iron pill. And you don't take an iron pill from a pharmacy. I mean, come on, you're just swallowing iron. That's the worst. That's toxic. You get a liquid iron. There's one called Floradix, Flora-Dix. It's liquid, made from plants. It's totally absorbable. And if you take the wrong kind, the ones from a pharmacy, you're going to get constipated. You're probably going to get headaches, and your hemoglobin won't go up. So with her, I hadn't had a chance to speak with her about this, but I would tell you directly that unless you're exhausted, don't bother with iron at all. And if you are tired, get the Floradix. It's available everywhere. Probably in stores wherever you live, but I know it's online everywhere. So the rest of the, they're going to send her to get an injection. an injection of iron. What bullshit. That's like an injection of B12. They have you going and get the injections. Man, if you need B12, take the lozenge you put under your tongue. That works way better. That form will stay in your system a lot longer. When you get an injection of B12, it's out of your body the next time you take a leak, next time you pee. So, don't bother with the injections from them. Next sentence is, they have said that I should reduce the Actasa. Now, this is earth-shattering. They said they should reduce the Actasa from 6 tablets a day to the maintenance of 3 a day. Imagine that. I've never heard that. I've been on air and written it that I've never once heard of a doctor voluntarily recommending a reduction in a biologic or any other similar drugs. Never. This is the first. So I think the doctors are probably pretty impressed with their progress. They don't know how to explain it, but they're conscientious enough to do the right thing. I've never heard of a doctor saying, A, stop the drug. Never. All they do is change. They'll say, well, just substituting one from the other or adding on. So this is, for me, this is like a lightning bolt. I couldn't believe it. I had to read it like 3 times. Then she just, and I'm going to tell you, if this happens to you, what I'd recommend. She said, should I continue the supplements as you prescribed at the same dose? Yes, because here's the deal with prescription medications, is we take the prescription medications when we need them. If someone needs a biologic, let's get it. Okay, my program was going to fix you whether you're taking it or not. The issue is that if you still have symptoms and you're taking any drug, the first thing we do before we go off the drug is we use the supplements to bring the remaining symptoms down. So you can say, okay, we're taking the drug, we're taking the supplements, no symptoms. That's when we start to reduce the medications. Like this doctor did. Don't think they really know what they're doing because they don't know what I'm doing, but that's effectively what's happening. Lower the dose. She's going to do that in a few weeks, and we'll see what happens. I'll say to her, I haven't responded yet, but I'll say, hey, let's see what happens after 2 weeks. When you stop the medication, we need to reduce the medication, we need to wait a couple more weeks. There's a lag there. We want to see what happens. But we like the drugs when we need them, and we get down to being symptom-free. We then start to tinker with the medication, and then eventually we go off the medication. I'm going to talk about that on the radio show this evening. There's a whole science to how we wean off the drugs and how we wean off the supplements. It's interesting, and I'm going to talk about that this evening. But the last thing she said, I thank you so much. I would highly recommend you. Well, please do, and maybe recommend that doctor too, who had enough, insight to say that you don't need to take the full dose if you're doing better. So let's see. How do I get back on my screen here to see who's got the questions for me? I hope I'm still streaming. I might have lost her when I looked for her email. I might have lost everybody. Let's see. Did I? I'm not seeing where I'm still on the air. Let me go back and get on again. It's still streaming, so I guess you heard me. So let's see if we got some questions here. I'm seeing we have viewers, and I don't see the questions yet. So refreshing chat. There we go. We got one of our favorites. We got Danny on here. Danielle. What does it mean when you touch your lower abdomen and feel and hear fluid? Does this go away over time? Well, what it means is you're retaining fluid because there's some inflammation somewhere. Typically fluid accumulates where it's inflamed, and that means that that's what the body does when there's inflammation. Say you sprain your ankle, when there's any kind of damage, something traumatic happens. That's what swelling is. I've seen somebody with liver disease; they get swollen all around down there, just because it's trying to offset the inflammation. So that means that you have something there that's still not healed. It could be like a little pinhole. Typically, after I've been treating somebody for a while, when there's something remaining, it's usually very tiny, very small, like a pinhole, and the body would retain fluid there. And if you feel a little bit of pain, then that explains it further. Okay, we have Maureen here. Have you found a correlation between skin issues, and she refers to acne, rashes, red patches, as a reflection of what is going on inside the gut? Do they indicate a flare? Well, yes and no. You got your genetic issues like psoriasis, and those can be aggravated by a flare. Um, but then when you have things like acne, the you know hives even, things that come up that represent there's an irritant in the system. I have not found that if you have chronic, say, IBS, I have not found that they'll give you anything like eczema. It's more like a rosacea look, if you know what rosacea is. Rosacea is when the blood vessels, like in the cheeks, the little capillaries, corpuscles, they get thin. It's a genetic issue mainly, and your face gets, you always have like a really rosy cheeks more than normal, and that's because the tiny amounts of blood is leaking through there, and the corpuscles. And so, what do? You take things that I'll give you an old-fashioned remedy. Rose hips. You ever heard of rose hips? That's old-fashioned vitamin C when they used to take rose hips, and you get the bioflavonoids, which means that they didn't just take the vitamin C out, they took some of the other factors that are the things that do the work. If you have any kind of thing like that, varicose veins will respond to that over a long period of time. There's something called bioflavonoids. Bioflavonoids is what this rose hips has, and those are little tiny. They're little tiny builders. Like when you peel an orange, you see that white stringy stuff. Yeah, that contains bioflavonoids, which are like little cement things that will build the corpuscles for the rosacea. You take rosacea, and you maybe take that for might be even a couple of weeks. You could quiet that down to make it go away. It takes quite a while, just like varicose veins. But to say that I've seen any, people have a rash sometimes when they're flared up, but most of the time they don't. So I don't really see any correlation. Now, acne is a different story. Acne is when you have basically IBS of the face. Is that the stomach is a circle, and it needs to have that mucosal lining protecting it. The inner part of the circle, inner part of the stomach, and the mucosal lining is the localized immune system. So picture your skin cells as a stomach. Stuff has to come in and then be processed and then kicked out. Well, when you don't have enough of the mucosal lining, you lack the ability to properly process stuff, and also you lack a localized immune system. It's the software, the hardware. So your cells will work like as if you had IBS or colitis. You'll have a combination with acne. You can have inflammation, and you can have infections. Because here's what happens to a lot of people who come to me with IBS and such. They had antibiotics for acne in high school, and they end up with IBS. And then the most common treatment, initial treatment for acne is antibiotics. So you see that connection in that way, but the other things, I don't see them. No. Okay, the crab man, we see him around. Crab man sighting. Does mouthwash hurt or good bacteria? Good question. I was just having a conversation with myself maybe recently, yesterday maybe, about that. Yes, I guess that, you get Tom's mouthwashes and things like that. No, but regular Listerine, absolutely. And they hide the names of these antibiotics on there. You're not going to see on the list of stuff antibiotics. You go scrambling through Google, you'll see some of the names they're using have antibacterial properties. So you're swishing. It's wonderful for them. You want bad breath? Destroy all the microbiome in your mouth. Okay. You want gum disease? You want dental, disease? You want cavities? Yeah, destroy all that in your mouth, and then you'll have bad breath, and you'll have loose teeth. It's nice. It's good for them. You have bad breath, just go get some Listerine. Let's get the stronger one. Yes, it does. And that's one of the ways you get geographic tongue. I tasted it once just to see what it was like. I said, holy, people's putting this in their mouth just for the taste factor. If you want geographic tongue, gargle with that stuff. And certainly nobody's swallowing that. Sabacan, here you are. Chaka Khan's boyfriend, or I should say brother, I should say. Chaka Khan. What about not tired but low iron in pregnancy? Okay, that's when you would use the liquid. If you're tired and you believe it's iron, or it's been shown in a test, sure. I'm just not a big believer in iron unless you're exhausted, because most of the iron people are taking is toxic, making them constipated. You can't go wrong with the Floradix. A lot of people just use it every day anyways because they want to have nice levels of iron because it doesn't load you up. Yeah, and it's safe, totally safe for pregnancy because it's basically, I think it's grape juice and some other, you'll see on the box it has fruits, maybe some vegetables. Okay, Crystal Williams, haven't heard you before. You're saying, LOL, I just had a B12 shot. What lozenge do you recommend? They're called sublingual. Most of the companies make them. You go into Whole Foods with their very weak nutritional supplement section. You find it. I think all the big companies make it. It's just sublingual. You put it on your tongue, and they come in micrograms. When you take something on your tongue, certain nutrients do well. They go into the buccal cavity, which means they just go through the cells on your tongue, and it goes right to your bloodstream. It doesn't require digestion. B12 will get chewed up, most of it with digestion. There are foods with B12, like animal products. So if you're a vegan, you want to get your B12. I'm not that hip on what vegans do, so I don't want to go too far and get the wrath of the vegans, but you may be low on B12 unless you have a source. What's a great source of B12 is our spirulina, my friends. Spirulina. Love it. I keep thinking about it more and more, and I'm gonna listen. I know my friend who asked me this is good-natured, but the day I said, in the United States, for those in the United States, we know the term when we say, hey, you should take a bath in that stuff, meaning it's really good for you. Hey, take a bath in that stuff. So when I said take the spirulina, he said, do you think it would be good for me with my issues? I said, geez, you should take a bath in this stuff. Well, then when he wrote back, hey, how much water and spirulina do I put in the bathtub? And the other one, and I hope he's listening because he's a good-natured guy, he's been having trouble fixing the guy's problem. I'm still working with him. He's pleading with me. He says, come up with another program. He says, do you think the effing protocol will work for me? I'm up for it. I'll do it. So, let's see. Crystal, 12, the B12 shot, they hustle you into the office in there. And they get some assistant or nurse who just gives you a shot. I know some people that started taking the shot and their neuropathy did feel better. They give it to you for neuropathy. And it did help. And not to say it's useless. I probably said that. Much better with the sublingual. Any of the big companies. Let's see here. We got Tammy Lynn. I've heard of her before. How do you determine who needs fish oil? I knew this was coming because I saw a post you wrote. Didn't you, Tammy? You wrote, geez, I'd never recommend fish oil for me. How do you determine who needs fish oil and who doesn't? Is there any other reason why you wouldn't prescribe it other than bleeding? Yeah, there is, because it's a long line of stuff that I prescribe, and I make a choice of what I think is best for you. And right now, I did think this about this after I saw you post on my Facebook page. I do recommend it for you. I don't have any other reason other than I've given you a long list of things that I all felt would work, and most of them have. And now I would say it is time for a fish oil. So I don't have an excuse other than I just didn't get around to recommending it for you. So what else we got here? Crystal writes, heard you, okay. Maureen, I can still hear you. Oh, okay, fine. I'm still getting a little bit used to the technology. I was looking for an email and couldn't find my screen here for the show. Okay, Kat, if ulcerative proctitis is healed, where there's no symptoms, and no supplements are taken, but still a little geographic tongue, very little is present, will it continue healing to complete the healing? Here's a momentum, simple term, right? I use it maybe a little different than somebody does. Momentum is when you have essentially healed something, like you're very close, and you just stop taking supplements. It'll continue to heal. Geographic tongue is the other end of the pipe, right? It doesn't mean there's anything going on down below. It just means that there's not enough, the microbiome is not covering the tongue. I swore I would never use that term, but here I am. So yeah, geographic tongue will go away. You might want to, I don't know if you're using colloidal silver. If it's stubborn, if it hangs around, gargle with some colloidal silver, and then take some liquid probiotic, or open some capsules, mix a little bit of water in there so it's pasty, put it on your tongue, and try not to swallow for a little while. I don't know how long you can go without sticking your tongue out, but yeah, that's directly putting it on there. Don't eat or drink for a while. Anyway, with these things, anyway, and colloidal silver is the best example. Any way you can think of applying that stuff, do it. I mean, I discovered how good it was when someone had a radio show. I ended up taking over the radio show, but they came to me and they said, to one of my employees, said, I have a rare eye disease, I'm going to Japan, blah, blah, blah. So Steve said, colloidal silver. And I said, in the eye? He said, yeah, colloidal silver. A friend of ours later on, who wrote the book on silver, told us you can put it anywhere you can conceive. Anywhere you can conceive. Sure enough, her eye disease went away. And I've had many people, we put it right in their eye in one of our stores, on your mouth. What you do is you soak it, put it in some water, or just directly take a teaspoon and suck on it, switch it around, gargle, swallow. Okay. Yes, it will turn into complete healing. Sabacan, take rose hips for rosacea orally, topically. They don't make rose hips. I don't know. Maybe a company does. You can look it up online. Rose hips, topical, but it's a old school vitamin C product. If you look online, you'll always see rose hips, and it's got the bioflavonoids. You might be better off just buying bioflavonoids. I'm trying to think of right now. I'm going to post it on the knowledge base website on Holistic Gastroenterology.com. Once I remember it, there's a protocol for rosacea that works really well, but I have to remember, you got to remember I've been out of that game for 20 years. I'm surprised I can remember any of it. So I'll post that on there. I might even talk about it. I'll make a note to talk about it on the show tonight, because there's a lot of people with rosacea and they don't know that there's any option. They just have to live with it. No, it's not true. So I'm trying to think of the other, maybe somebody can help me, natural antihistamine. Somebody will go online and look at the antihistamines and maybe write 3 or 4 of them on there, and I'll say, yes, that's the one. Because what we did, we had a staff of people that was amazing geniuses. So everything we had for a protocol was state-of-the-art. We invented a lot of them that vitamin companies now use. So we didn't mess around with stuff that worked kind of good, maybe. We only did the right stuff. And I have to remember, I never did remember that stuff really well. So if somebody look up the best natural antihistamines, I bet it's going to be one of the ones I'm going to write rosacea, one of the ones that we had used along with the bioflavonoids, and that'll give you a ticket out of rosacea. Yeah, Crystal, we're seeing your comments. You wrote a little while ago, and I answered. Do you okay, here's another one. I like this question. Do you suggest, this is from Kat, completely stopping statin drugs and taking the Probac and colostrum and following it up? Well, I don't know where I said that. Did I say it last week? I was going to mention it today. The question is, do you suggest completely stopping statin drugs and taking a probiotic and colostrum and following it with red yeast rice extract? How much each day? This has never failed. Never failed. By the way, all you guys out there that are taking a probiotic, if you're not taking colostrum with it, quercetin. Tammy Lynn, quercetin. Yes, ma'am. Quercetin with the bioflavonoids. That's your ticket out of rosacea. Bingo. Thank you, Tammy Lynn. Statin drugs, they take out the coenzyme Q10, and they also take out the hormones. I'm not going to go into a long thing about it because I think I did it last week. They're taking the cholesterol, which is actually a fantastic thing, out of your system, and now you can't produce hormones. That's why it says on the advertisement on TV, you can't get an erection, you can't do this, and because they're pulling the hormones out of you, man. The statin, the red yeast rice doesn't do that. So probiotic without colostrum won't work. It won't do anything for you. With colostrum, it goes in there, and what's it do? It acts. Now we have our sacred software, and it recognizes, oh, you're a fat molecule. And we know how to digest you, and we have the software computation power to do it because we tuned up our software. It's going to recognize the fat, digest it, and then it's going to go out to the bloodstream and turn into a hormone. Listen, one of the worst things you can do to a human being is suck the cholesterol out of their body. Cholesterol, we need it. It's gold. Dietary fat, and here's the beautiful thing about probiotics. If you have like trans fatty acids, what bullshit that one was, and just say some gunky fat from some place that was cooking onion rings all day and fat, you swallow that. Guess what? The mucosal lining probiotic bacteria with the colostrum, that will rearrange the molecular structure. It'll rearrange it and spit it out to the bloodstream as perfect cholesterol. The problem is when you're not digesting your fats, it goes out as undigested fat in the bloodstream. You need the red yeast rice to clear that out. Not to clear out cholesterol, to clear out the stuff that's been hanging around, loitering. They'll put up a no loitering sign. Okay, red yeast rice is going to clear out. You don't have to take that for very long. You know, the first month it's going to take you to set up your machine in your gut that's going to process the fats properly, and it's going to take you a month because you're still for a while going to be dumping bad fats into your blood vessels, and then the Q10 clears that out. After about a month of that, you don't need the CoQ10. The red yeast rice. And some people are trying to tell us that the red yeast rice takes out Q10. I don't think so, but some companies are making it red yeast with Q10 in it. So Maureen, is it okay to take George's aloe vera along with the protocol? Yeah, George's aloe vera is pretty good. It's kind of confounding to me. George's is clear, clear, looks like water. And I always believed that you needed the like Lily of the Valley brand that had the thickness. It was like a gel, because those little I forget what they call them now because I'm rusty. Little things that make up the what are they called? The thickness of the juice was what healed you. And George has come along. It's been around a long time. It heals everybody. It's like, hey man, what'd you do with all that stuck stuff in there, that sticky stuff? And it's clear and it heals. I've never heard a bad thing about George's. The only thing with aloe, once in a while, it burns. I don't know how some people it burns. You swallow it, go, oh my God, it tastes like apple cider vinegar. But not usually, because it's actually good for burns topically. Okay, Kat, how does a scab break off and then blood is visible in the stool when the mucosal lining heals first and is covering the tissue? Well, the mucosal lining doesn't necessarily heal uniformly everywhere. You've got 20 plus feet of intestines packed into your torso, and some of you are little people. There's a lot of tight turns and flaps and folds in there, and it can take the mucosal lining even years to cover every tiny spot. So you might have a spot in a tight turn, like a hip turn, that doesn't have quite enough mucosal lining. Here comes something innocent. First of all, it could be some fiber, but it could be something innocent. Just they go by and they're scraping, a little bit as they pass through that little turn. So that's when you can have the it's like the old days when we didn't have these razors we have now, and you had to drop the razor blade into the thing, and they would, every time I shave, I get nicked. And we'd always put toilet paper on there. Go to work, you get toilet paper hanging off your chin, and we did that because the tiniest cut could take all day to stop. And so the same thing with your intestines. You can have all of a sudden blood and go, what? And then because it did a little nick, and that would be the reason. Okay, Dan, back for more. What are your thoughts about a colonoscopy after healing? I'm kind of 50-50 on it. I mean, I do believe you should have one when you get older. I never had one until I was 60 something. And it's not, I mean, it really isn't a big deal. Some people have problems with the contrast. I'm just not a person that worries. It doesn't bother me. I drank it, and, didn't bother me. But it doesn't wipe away, A. Doesn't wash out your mucosal lining. That's the first thing that comes up. Colonoscopy, I would wait until you have no symptoms for at least, say, 6 months. You don't want to take any chance. We've had people have a colonoscopy during treatment and just afterwards, and it seems to split some of the tissue and they start having symptoms again. I think once you've got 6 months under your belt of no problem, no symptoms, then it's safe. So how about, we got Laura here. Do the pockets from diverticulitis go away after the protocol? Yeah, diverticulosis, everyone doesn't know the distinction between the two. Diverticulosis is basically just when the bowel gets weak, the muscles get weak, and they do it kind of not all at the same time. So you have one part of the muscle getting weak, the other part's going strong, and you can have some malfunction. That's when people get like, they can't, they get a little bit of leakage going on when they get a little older. But yeah, when you take diverticulitis and you got these little pockets, how did the pockets get there? I'm raising my hand. I know. Anyone else know? Raise your hand. From the lack of mucosal lining, the acid eating a hole through the tissue. There's a hole there, and waste gets caught up in there, and you get an infection. And what do they give you? Antibiotics. Tough part about treating diverticulitis, when the people come to me, they're not having an attack. It's usually a one-day affair, and they give you some antibiotics, and they kill the infection, but they did nothing to repair the hole and cover it up with mucosal lining. And so when I'm treating them, they're not having an attack. So, we don't have something to say, oh, you're having diarrhea for a week, now you're not having it because of the treatment. It's like up in the air and say, well, how do I know it's being effective? The only way to really know is see how long you go without another attack. Most people have them, once a year, and you're lucky if you have one, if you only have one. So that's the way we treat that, is we just have to keep our fingers crossed, knowing we did the right thing, and make sure it really stuck. Okay, now we got, as she and Laurie wrote, is diverticulitis the same as IBS? No, not really. Diverticulitis is more that whole infection issue. The IBS is just low-grade infection. Inflammation. IBS, colitis, and Crohn's are all the same thing. It's just a matter of how roughed up the bowel was. Is it first, second, third degree burn? Is it a pothole that's deep? One's deeper, one's more shallow? There's still potholes. Okay, all it is like you scraped your knee, or did you really scrape it? We might say, oh, that's colitis. You really, really scraped it? Crohn's. They're all the same thing. Let's see. Yeah, it makes the flare worse. Maybe you're talking about George's or aloe in general. It happens. It's not quite 50-50, but and every company that makes an aloe vera product talks about that. They're not bioflavonoids. There's something else that's in the aloe when you see it thick and you can't see through it. And most everybody says that's what's the healing. And George's doesn't have that in there. So, Crystal, boy, you're busy today, Crystal. My son was told a few years ago he could have the beginning stages of Crohn's. Today he had a scope and doc said colon is very healthy, but his stomach looks red and inflamed. She took biopsies. Well, we hear that, and I'm always, I'm a very positive person, but I'll say if you didn't do a protocol that's going to actually heal it the way I'd say to heal it, it's going to come back. Body goes into recession for unknown reasons. So I hope I'm wrong about that. And people ask, well, can it travel? Well, you got to realize it's one long roadway, one long pipe, esophagus down to the stomach, small and large intestine. There's no, it's all one roadway. So sometimes the inflammation can appear upstairs after it was downstairs for a while. And I don't always have the reason to explain why. I mean, I had a patient today had collagenous colitis. And, she didn't say so specifically, but I think it was suggested to her she had something that was incurable, and the doctor told her, we don't know what you have. And her immune system was expanding and working at a high rate. I said, well, hallelujah, let's raise that immune system. That's nothing unique to collagenous colitis, because we need the immune system there to help. It's not causing it. It's here to help. If you have an inflammatory bowel condition and your immune system isn't at an elevated level, we got to get it elevated, not smush it down. So as far as your son goes, I don't know what biopsy is going to do. I've never paid attention to them. When someone says, "Well, it's a biopsy," I say, "Good, keep it." So I don't know how to explain what he's going through. Was he on a drug? Sometimes when you go on a drug, it's like having a sunburn at the early stages of, like, again, Crohn's is the same thing as the other conditions. But if there's a early stage, it'll be like a sunburn. And you go on a drug, even some of the drugs like the acid reflux drugs they put on, the proton pump inhibitors, or even the over-the-counter stuff, it gives a break. It's like sitting in the shade for a while or putting a little bit of sunscreen on. It gives a break. You say, "Wow, it's looking better." Well, I don't know about your son, but it might have been that he was taking some kind of medication that gave the skin there a break from the acid. Okay, Kat. WebMD. Oh, WebMD. I'm smarter than WebMD. WebMD stated spirulina, the protein spirulina can reduce the body's absorption of cholesterol. Hey, good news. I like WebMD when it agrees with me. Do I really mean undigested fat? Yeah, undigested fat. Not properly digested, where the molecular structure hasn't been properly processed, so that hasn't been completed, so that the fat is incomplete. It needs to be totally digested in a certain way. What they do, when something is digested, the molecular structure is changed, shuffled in the deck. And with fats, the inferior fats don't have that organization, and the probiotic will rearrange that and make it more organized, and then it turns into cholesterol. Cholesterol is perfect, and it doesn't need to be swept out of the body, because then it's going to be converted into hormones. Okay, so how many guys out there start taking cholesterol medications and you can't get it up anymore? Okay, I'm not raising my hand. No way. But or how many people have had trouble sleeping after taking the statin drugs, or depressed, or pains? Okay, how many people have did I say depression, lack of energy? That's all because it swept cholesterol unnecessarily out of your body, and you're just the pancreas says, "What about me? I can't produce insulin." Oh, you're diabetic. Sometimes it seems like there's a conspiracy. I think Tammy was saying the colonoscopy makes flares worse. Maybe that was your experience. But spirulina, it's beyond scrutiny. It is beyond scrutiny. It's such a perfect food, and it's going to do so much for you. I try to stay within my lane in terms of what I do. The things that I know that I will share will be on the knowledge base, just how to fix sinus issues, and prostatitis is one of my favorites. When you're 27 years old, man, and the doctor says you have prostate problems, yeah, you do, but you don't have a prostate problem like I would have. You have prostatitis. Took some antibiotics that wiped out the mucosal lining that protects your prostate, and the localized acids are irritating it, and you have to urinate all the time. It doesn't mean you're an old man. So that's what that's things like you're going to see on WebMD. Hallelujah, there's some good stuff on there, but there's some total bullshit on there. It's totally medically based, and there's limits to what they know. Otherwise, hallelujah, I love them. I love anything medical if I need it. There's no new questions at the moment. So I was going to talk about, let's see here, I made a couple notes for myself. How to wean off of supplements. When I tell you, or someone tells you, hey, you're all set when that day comes with you and me, how are we going to do that? I love this one. I can't remember how I came up with this one, but it's the right way. I think I was thinking of saving people money, actually, is that when you have no symptoms, we've got off the drugs, now we're sitting here with just some supplements. What are we going to do now? Well, we're going to keep taking them until we run out of them. You run out of supplement A, you don't replace it. And we observe, okay, what happens when we stop vitamin A, supplement A? Nothing. Okay, next one we run out of. Vitamin C. Okay, stop taking it. So what happens? Nothing? Let's go to the next one. As you run out of them, you don't replace them. After you don't replace something, if a symptom pops up, it tells you need that one. Otherwise, when you run out of them and there's no symptoms, you're healed. And there's no need for anything. By the time you're healed, there's no need for any dietary restrictions. I rarely have anybody that still has the inability to digest gluten or dairy after we're done with them. So that's another side benefit. Kat has another question. Why do some people never have symptoms of inflammation and or loose stool, I guess? I'm sorry, I got to read these questions better. Why do some people never have symptoms of inflammation and they have lost their mucosal lining even though they've been on many rounds of antibiotics? Have been in chlorine pools for many years. Okay, that's one of my favorite ones. Why have people had many antibiotics and you're sitting there, you have to eat nothing but, Uncle Ben's rice because you had an antibiotic 10 years ago and the other person just been drowning in antibiotics and they don't have any gut problems? Okay, the answer is this: antibiotics are never free. The very fact that they can kill off a germ like a bacteria and you feel better is priceless, but it also proves that it's always biologically active. Okay, the beneficial bacteria that makes up your mucosal lining, the microbiome, is also vulnerable to antibiotics. Okay, but those antibiotics, like I described in the stomach, they're also antibiotics, I should say, the probiotics in the mucosal lining, in the lungs, they're in the sinuses, they're in the bladder, urinary tract, prostate area, eyeballs, every cell in your body. So if Uncle Charlie over there, who's the one eating his fourth hot dog, and he seems to have no problems, you don't know what he's doing with the inhaler, or does he have to take antihistamines for his sinuses, or is he having prostate problems? Because all those are called mucous membranes, all those locations, and they require the probiotic and the colostrum to make up the mucosal lining and do all the things we've talked about many times. So it isn't just the GI tract. If you were to probe, you'd find that maybe all of them, maybe most of them, if I wouldn't be able to explain the ones who didn't have a problem. Also, I'd like to say, you don't know what that person's working on. If you had x-ray vision, you might look and say, wow, that guy's like inside, and see inside his bowel. Imagine that. Inside his bowel, and you can see that that guy's one antibiotic away from being tapped out with his mucosal lining. You don't know where they stand, but it's not free. You do not take an antibiotic without losing some of your good stuff. Okay, so Daniel, what does it mean when a person has mild cramping in their gut followed by mucus? This is probably connected to your water issue, right? And you know the answer to this, Daniel. You know the answer to this. When there's mild cramping, it means that there's still the mucosal line is not thick enough in that area, and the acid is penetrating a little bit, irritating the bowel. And what's the other part of the question? Followed by mucus. Mucus is fantastic stuff. Our body produces it. It's a cousin of what comes out of your nose when you're sick, because it does the same thing. When you have mucus coming out of your nose or in your coughing, it's in your chest. It's there to protect you. How many people do you know that smoke that have to hack up the mucus? Well, it's extra mucus is sent to the lungs to protect against that toxic stuff that you're taking in. When you're sick with a cold or something, it produces mucus to protect the lining of the sinus or the lungs and the throat, because you didn't have enough mucosal lining, and the body's spewing out the histamines to kill the germs, and it's going to irritate the wall of the sinus, or whichever part we're talking about. And then the body says, you know what, send some mucus in there and just gum up the works, kind of like crawl up on the wall of the sinus of the lung or whatever, and just sort of get in the way. And so it's always there to help us. You know, I always say thank God for diarrhea and thank God for mucus. We didn't have mucus pouring out of us sometimes. I had a person today that just mucus pouring out of them. She says, I never have a bowel movement. It's just mucus. Well, it's there to help you. And it's usually the last thing to go away. People all the time are saying to me, when's the mucus going to go away? And I say, when you're completely healed. Well, other people are healed and they still have mucus. Well, their system is not as overprotective as yours is. Okay? Tammy says, is it beneficial to keep taking the probiotic and colostrum the entire time while in the protocol? I usually don't do that. Because after a while it matures. It matures and it's there, it stays there, and it does what it's supposed to do. And sometimes when you take probiotics longer than you really need them, it'll cause some bloating. Because basically the body's saying, hey man, keep sending this stuff down here. We're all set. We don't need that. And anything that you do that with, it ferments it, and just burns it off, and gives off gas. Maureen Rudder. Years of Crohn's and daily pain takes an emotional toll on my daughter. As she heals on the protocol, is there anything that supports the nervous system while healing? Well, yeah, there's some stuff that supports the nervous system. It's got an old school name called lecithin, Lecithin. The new version is called phosphatidylcholine, I can't spell the rest of it, PHOS, phosphatidyl. You'll be able to find that. What's that do? Well, it's what's supposed to help people who have MS. There's something called a myelin sheath. It's like a gooey, looks like Vaseline. Protects it coats the wires that are your nerves. And the mucosal lining is something that's in the gut. Well, it's similar to what's in the wires, the nerves, covers it and protects it, the myelin sheath. I don't know how much damage stress does to a nerve. I know, again, I'm not in the vitamin B business at all, but they'll say vitamin B, which would be the B complex, all of them, and lecithin, otherwise known as phosphatidylcholine. And if you want to build a really good brain, this stuff you see on TV, I can't remember the name of them, the stuff for every 5 minutes, the stuff for the brain, for the memory, screw that. Go with phosphatidylserine, Serine, for prevent dementia and memory, stuff like that. That phosphatidyl, that's a form of B vitamins, phosphorus, and it takes many shapes and forms. If you have a liver problem, you want to load it up with phosphorus in some form like that. So let's see what else we got here. Okay, Maureen says she swears by ashwagandha, an Ayurvedic herb, and theanine. Okay, I believe you, and I know Maureen a little bit now, so I believe anything she says. They're talking about the most thorough person in the world. You want someone to give you the details of a subject. I tell you, funny, Maureen doesn't care, I'm sure. She sent me an original email, giving me all the background on her daughter for our appointment. The longest email I ever got. So then she sends, doing a little bit of homework for me, she's helping me determine what we're going to call the knowledge base. Come up with some great ideas, using the word digest. And so her abbreviated lists are massive. But so the other day, I got an email from her saying, here's my ideas. And I scrolled down a little bit and said, wow, that's great. And I started to write an email saying, I can't believe the restraint you just held back, you didn't usually. And then I scrolled down a little further. I realized that there was like 19 more paragraphs, so I had to delete that. So she's doing good with these short questions. I don't know how you're doing it, Maureen. But as far as your answer goes, that's all I know. And I go into the homeopathics. For nerve issues, phosphorus has a zillion different phosphorus this and phosphorus that in homeopathy. So that's what I would do. He is always bloated. This is Crystal. Feels full, feels liquid, and pain on the lower right side. That means I don't know who your son is. Is he a patient of mine? Well, that means that he needs to tone up his abdominal wall and get the mucosal lining going. I'm so boring with all that stuff, but the protocol, the GI Cure, really does all these things, and you apply it to your sinuses and your toenails and everything else. You're setting up the sacred microbiome. I hate that term, but I'm using it all the time now because it's kind of like a designer term, yuppie term. It it's in every cell, man. If you're trying to heal your toenails and you got no software in there, well, that's the reason that the fungus is there in the first place. Because the software is your mucosal lining, and that's your immune system. So then the toenail fungus shows up. I don't have toenail fungus because I am loaded with probiotics and colostrum. And so if you want to get the benefit, I was telling somebody recently, you're eating organic food, right? Good. And you're taking the best line of vitamins. If you don't have the software in each cell, you're either going to get little and none benefit from all that you're doing. And I used to tell people on the radio, well begun is half done. Let's see who's on the phone here, by the way. Well begun is half done. If you put the foundation in, most of your problems are going to go away. And the ones that are left over will be much easier to knock off. Let's find out if they want to talk to me or they want to collect some money from me or what they got. What's going on here, folks? Hi, Dr. Snow. Can I help you?
Hello, Dr. Snow. How are you?
You're on the air right now on my radio show. Do you want to talk or you want to call me back later?
Okay. I can call you back later.
Okay.
I didn't know you have a radio show.
Well,
I'll talk one of these days.
It's actually YouTube.
I'll call later.
Okay, bye. I thought I was going to get a date out of that one too when she wanted to go. Shucks. You put the mucosal lining back in. I'm going to bore the hell out of you, and most of what you have will go away. I used to tell people, again on the radio show when I had a bunch of offices, I'd say, before you even come see me, because it took like a year to get in to see me, before you even come see me, do two things. Put the mucosal lining back in and clean your bowel out. Take some kind of bowel cleansing formula, which I used to tell them. There's one called Colon Max, which is really the best. And then you probably won't even need to see me, because that'll take care of what my teacher used to say, well begun is half done. So now we have Kira. When you have mucus in your system, is it healing or helping to heal? Or is it just flushing things out and protecting your lining? Well, it's the last thing. It's protecting. It has a... it's similar to the mucus that makes the mucosal lining, and similar to what is coming out of your nose. They're all the same family, but it's there to protect and lubricate. Let things slide out, protect the tissue, and it's oftentimes overprotective. It doesn't really have any other function. It's not a immune thing, but it will protect the walls until they're protected by the mucosal lining itself, and it's good, but we don't want to see it around there forever. So let's see, which form of phosphorus for nerve tissues? Well, phosphatidylcholine. Phosphatidylcholine. That's the one that I've used most of the time. The serine form that's like an amino acid, I believe. So what they do is they bind these things, these fundamental things like phosphorus, to other nutrients, and it'll go off and do what we want. That amino acid is targeted towards the brain. It'll go up and bring the phosphorus with it and build a nice thick mucosal lining, or the nervous system, whatever we're treating. That's something that there's a real science to that. I've done a lot with that. I innovate a lot with my spirulina probiotic and ginkgo. Whatever you want to heal, if you take MSM and ginkgo with it, it's going to do better. Except for if you're currently bleeding, because it pushes the blood, it will cause more bleeding. It's one of those, it's not actually a blood thinner, but it pushes the blood. So that's one of the ones you don't want to take if you're going to have surgery, if you're currently bleeding. People say, well, I'm going to take that because I got the proctitis and we got to get the blood all the way down there. Yeah, well, you're driving the blood to there and it's going to leak out more. Saba, man, you're a fast typer. Thank you, Tammy. She wrote. Tammy gave some information. I know the PC, but thought he mentioned some phosphorus too at the end. Laurie, badass, man. Laurie asked the bad questions. She comes out with some bold statements. We love Laurie. I don't have mucus, just soft, bulky stools. Well, congratulations. Just don't take a picture and send it to me. Okay, we currently have a rapidly escalating fine. If you send me a picture of anything to do with a stool or a hemorrhoid, $10,000 is a current fine. And what makes it even worse, I'll send you a signed picture of me and a Speedo. Nothing like a 69-year-old man with a Speedo. And I'll warn you, it had to be taken in twice. I've never heard of anybody having a baggy Speedo but me. So be careful. I had a woman say to me, it was like a portrait, she wanted to hang it on the wall, picture of it. What part per million colloidal silver do you recommend is safe to swish and swallow? Well, any one. There's no one that's, it's homeopathic. It's, parts per million. And the higher the parts per million, the more potent it is. With homeopathy, can make it sky-high potency, but it's going to be diluted, and you don't need to have any. You won't have any side effects. Yeah, they make these massively high doses of homeopathy, like these ml and these other letters that go behind the number, and but that's the idea behind homeopathy. Now with colloidal silver, it's a colloid, but it's made as an antibiotic. A natural antibiotic, as a homeopathic remedy. And I don't recommend any parts per million because it all works. If I'm going to grab a bottle, I'm going to go with a higher one. So it's not just the parts per million, though. It's the companies that sell it go into great pains to talk about the availability and the absorbability of it. So it's not just parts per million. Laurie. Let's see, what else we got here? Saba, I love you. What causes sticky stools alternating with dry? Oh, see, I don't know if I have an answer for that one. I don't have an answer for that. Your stool just isn't. Well, I guess I do have an answer. It's not perfectly formed, and that would be mucus. That would be mucus making it sticky. Mucus is something that's 3/4 of your stool, even when it looks perfect, is mucus. It's just in a different form, and so your body is obviously in the process of healing if it's you, and but there's no better answer than that. Okay, what else do we have? I don't have any other questions right now. We're getting close to closing time. I guess some cool subjects we're going to talk about tonight. It's question and answer. But if nobody calls in because it's a new time, we're just starting this thing tonight. So if no one calls in, I got some stories, some of my famous stories. You might not want to tune in because you're going to have to suffer through some of my funny stories that I think are funny. But if anyone calls in, has a question, we'll answer it. Otherwise, I'm telling stories about nutrition. I have a lot of funny stories about just cases I've seen. Cases I've seen. Some of them are graphic, and the only place I'll tell them is on that radio show. I don't have anything that's X-rated, not many, but I'll just tell you real quick. Somebody, a person out in Seattle, didn't have a bowel movement for a long time, and it turns out they had an obstruction in their bowel. It was something that they had obstructed. It wasn't internal obstruction. I kept saying to her, "This is impossible." How you mean? What do you mean? Something stuck in there or what? No. Well, it turns out there was. I've heard it all. So the phone number for the radio show is 508-244-1815. It's going to sound just like this. You're not going to have to do the chat. So you're going to call and say hi, and we're going to talk, and it's going to be heard through the radio channel. So I'm the guy that talks. I have no idea where to find this stuff. Hey Tammy, can you put it up again if you haven't already? How they find this thing, and you'll be able to. I think there's a link just below. I was told to use the words. Click the link below. Also, an icon on the Holistic Gastroenterology website up in the upper left-hand corner, and go to radio.co. That's .co, and you'll find a directory there. It's going to be a great show. We decided to do it just minutes ago. So if I sound like I don't know what I'm talking about, I don't. But the call in will go to 508-244-1815. That's my personal number. Pick it up. We might also get some people to call up that are non health related. That if they want to talk, we'll put them on. If they're funny, they stay. If they're not funny, we hang up. Oh, now Crabman wants to know about vaccines, bro. No, no, no. No, no, no. Not doing that, man. No, no, no. All I'll tell you is that I've had them. Mandy's like in running for a couple things. The nicest person in the universe, she's in the running. She's right up there. And the fastest. You send her a message, before you even send it, you get return. Amazing. My son has tiny spots on his back from when he was on steroids. Will the protocol help clear these away? Well, not the protocol, but just, the cells will be loaded, yes, with the mucosal lining in every cell, and it normalizes things. It normalizes things that, if something doesn't go away that grows on us, we take like the enzyme or serapeptase. That takes care of bumps and lumps and things that aren't supposed to be around. Skin tags, stuff like that. Saba, will your live show follow daylight savings time after the time change? Whoa. We have Central Time, and your time, live time occurs at 3. Well, it's going to be, we're going to, if it's 7 o'clock in the evening, Eastern Time, now it's going to still be, it'll be when they make the change, it'll be 7 o'clock. That's when we're going to do it. Unless people come up with a better time. Tammy says a touchy subject, we don't want to talk about presidents, and we don't want to talk about vaccines. I don't even really have an opinion. I just do it, what I think is right. I'm not involved in any discourse or conversation, or don't even think about it. Intuition, man. You gotta go by the intuition. So we're done for now. There's no more questions. I hope I've given you enough information on how to find me tonight. If you're interested, you might be bored already. 508-244-1814, or is it 1815? 1815. Here I am giving my own number out wrong. 508-244-1815. 15. Let's see. Saba, we turn our clock back an hour. So yeah, okay. So tonight, Tammy, make sure they see you on the screen here. How to find me otherwise, and I'll be ready at 7 o'clock Eastern Standard Time. And as usual, everything goes. Did I miss a question, Maureen? What's the question? Is it a Maureen question? About the fistula. Okay, Maureen. See, the thing with Maureen, she's sweet. And she says to me, I'm a very quiet person. Yeah, get an email from Maureen. The threat she hangs over me, she's never said it, is that if I don't answer the question, open my email box, blown up. Had gut infection, hospital fistula right before starting the protocol. To prevent infection, anything else besides colloidal silver and George's, and of course the protocol? No, just the protocol. When people have a fistula, don't pay attention to the fistula. Don't put anything externally on it topically. It's just going to dry up and go away. All a fistula is a nerve that's been inflamed by the inflammation that's going on inside. The nerve is heated up. It's created a little tunnel for itself. It shows up on the cheek and the butt usually. And we say, hi. We don't pay attention to you. It's going to drain, and we put a ceton in there. Hi, see you later. It's going to drain, and then it's going to dry up and go away. I've never, after I've initially treated somebody, I've never mentioned the fistula again. Just say, hi, bye. So that is all the questions. Did I answer that one completely? Well, use those things. Silver, George's, I guess, and the protocol. So that's it for right now. I'll be back in a couple hours on the radio, and that's our first show. And I'll try to have it more organized than I did today. We just decided. I got an email saying, "Hey, you doing that thing at 7? What thing at 7?" So I'm scrambling, saying, "How am I going to tell people where to find it?" So I hope you get enough information. 1-508-244-1815. Thank you.